Hello, everyone. I'm here with Kurt Thompson. My name is Douglas White with the Academy of Orthopedic Physical Therapy Scope of Practice Task Force, and we're doing a little project on rural health in interviewing physical therapists that practice in rural health. And we'll be writing this up in OPTP for publication. And we're just getting some interesting perspectives from several PTs across the country. And Kurt is here graciously to kind of share his perspective on rural health. So, Kurt, if you don't mind, could you introduce yourself and your community and your environment for us?
Sure. My name is Kurt Thompson. I graduated from University of Kentucky, and I practice about 30 miles out of Lexington, Kentucky, in a small Kentucky town called Paris, Kentucky. It is in the county of Bourbon County. We have about 20,000 people here in the county. It's a small community hospital. We are part of it's Bourbon Community Hospital, part of the Life Point Hospital Systems. I have four full-time physical therapists. I have one part-time occupational therapist and one full-time speech therapist, and I have one PRN physical therapist. We have our hospital has about 58 beds. It's acute care. We have some ICU beds. We also have adolescent and behavioral health units at our hospital here. So that's kind of unique for where we are as far as in a small community to have that service here. We offer general inpatient, outpatient care. We also offer women's health issues, pelvic floor issues. We do some vestibular rehab, and then also I am a certified ergonomist, so I have done a lot of things in the local industry here in factories. So that kind of gives a sum up, kind of a unique staffing situation I have here. I have an excellent staff. It's been quite a few years in the work to get us to this point. But we average about 19 years of experience here at our clinic. So it's kind of a unique setting for us to be in right there. I have a lot of good, energetic therapists that love their job and love working in a small town.
As a dedicated orthopedic physical therapist, you understand the importance of staying current with the latest techniques to better serve your patients. With gait analysis, continuing education, and technology, RunDNA is committed to accelerating your expertise so you can help runners achieve their best. Visit rundna.com/AOPT to learn more and get your free ebook, Top 5 Things Running Professionals Need to Know.
It's very interesting. What do you find rewarding about practicing in a rural environment?
One of the things I find most rewarding is the relationships you build with your patients. And this morning was a great example. The lady I saw this morning, I have seen her daughter and I have seen her grandson. And it's a unique period of time. I call myself, I'm growing old with my patients. And that is very special to me because it's a compliment to us here in a small clinic, is that we get to see what happens to our patients after their injury. A lot of the times it's an athlete, maybe in high school, we'll pick up the local newspaper and it's been 3 months after rehab, we get an opportunity to see their picture playing football again on a Friday night here in town. And sometimes they're taking pictures with their mom and dads. We know their moms and dads from coming into the clinic, and it's just a special thing that you get is a nice relationship with your patients and their families. I've worked in large hospitals and large towns before, and I just never knew what happened to my patients after they left. And it's kind of nice to know what happened to them. Also, too, since I've been practicing here, and one of the advantages is we have quite a bit of an industry around here related to Toyota manufacturing, which they have their main Central Kentucky hub in Georgetown, Kentucky, which is another about 20 miles from us. So we have some ancillary factories that support them. I have been in all the factories in the local area, so I have a good idea of what our injured workers have to go back to, or people just had elective surgery have to go back to. And I think that's a plus. When I worked in the bigger towns, I couldn't get to everything I needed to get to have that basic knowledge. I'd get a job description or whatever that helped out. But it's nice to be able to go out there and say, oh yeah, I've been to your factory. I know what you've been doing. I walked your line. I know specifically what you need as far as rehab to get back to that job. So that works out really good. The only downside is to say to having a relationship with those, I can't get in and out of the grocery store really quickly. There's a very, very good chance if I have to just run in and pour a gallon of milk, that may take me 20 minutes because I run into one or two of my previous patients, and which is fine. I enjoy that, but it also calls for a little bit of a delay and a quick errand that I have to run. But it's well worth it. I think it's the biggest take-home thing for me at the end of the day is that I am honored to see another patient come in to the clinic, and they have referred a family member to me to come into the clinic to see me, and that's just a good feeling to have those close relationships and that they trust myself and my other therapist for their care of their family members.
Yeah, that's great. I can relate. You know, if I take a couple of days off, when I get back, people will be saying, "Were you away? I didn't see a truck out on the street." You know, what's going on?
Yeah, I've had it's funny to say too, because I've had patients drive past the hospital here, and I'll see them out, and I say, "Man, you've been burning the midnight oil. I saw you out there. Your car is still out there at 7 o'clock one evening." And it's like, oh wow. But
Yeah.
yeah,
The fun of a small town. But you know what you say kind of resonates a lot with me, and it kind of brings me to how rural health and primary care kind of intertwined to a large extent, because you know we don't just see people for a one-off kind of treat their condition. Um, they're likely to be involved in coming back to see us and their family members and whatnot, and they come to us with a variety of different things as well. It's not just that oh, I hurt my shoulder, I go see Kurt. It's you know, I've got this pain, I don't know what's going on. I'll go see Kurt and he'll help figure it out and we'll do what we need to do, type of thing.
right. Yeah.
So that's good. So what kind of things could you suggest that you could encourage people to get involved in practicing in a rural area?
The relationship that we've just talked about is the big one. The second thing is also the relationship with our local physicians here. A lot of them are single physician practices. I know them on a first name basis. I've been in their office quite a few times, and they're really accessible, which really helps in a small town to be able to have a follow-up saying, hey, I think this person needs a little bit more, maybe referral to an orthopedic specialist, maybe need a certain diagnostic test for them. And that's really nice. They're really accessible when it's nice to have that communication. They'll often call me if they have questions when there's a particular patient that's sitting in front of them there and ask whether or not they would be appropriate for physical therapy or not. So it's nice to have that relationship. Also, too, on the same thing on just being a small town hospital and a small clinic, we can make quick changes. And what I mean by that is we've had some changes here on the local home health scene that they don't have any real pediatric physical therapists that can see the caseload they need. So within the last couple of months here, we've just been nimble enough that we've brought in a PRN pediatric physical therapists that are going to start seeing some pediatric patients here at the clinic, occupational and speech. So that's a service line that we haven't had to offer before, but as a need was recognized in the community, we have absorbed that, and hopefully we'll be able to fill that need to people with pediatric children don't have to drive that 30 miles down to Lexington to see the pediatric therapist down there. So as a community hospital, we were nimble enough and quick enough to be able to react to that, and then kind of put the real reason for a community hospital is to offer as many services as possible that our town people here and our community and county people can come to their local hospital as opposed to drive 30 to 40 minutes to get their physical therapy, which makes for a very long day, almost a half a day out of their lives in order to travel that distance back and forth. And so it's nice to be able to do that. And that's some of the benefits of the small rural hospital.
That's great. I think we kind of touched on most of what we want to talk about. But I just, anything else about patient management that is different in a rural environment, both, challenging or rewarding, I guess.
Yeah, so one of the significant differences, I grew up in a city. I really didn't know much about farming, but a lot of my clients here have regular jobs, but they also farm on the side. Either they have cattle, horses are big in central Kentucky here, but they grow soybeans, corn, and you see some people still doing a little bit of tobacco, even that's kind of fallen by the wayside a little bit. But not only are you trying to get them back to their regular occupation, but also an injury can be devastating to a farmer that part-time farms that has 60 to 100 heads of cattle, that maybe they have a desk job during the day, but they still got to climb up onto their tractor and move hay and deal with cattle all the time. So that's been a big learning experience for me, is that the farming is just important as their primary job. And I've had to learn a lot about what it takes to be a farmer, and just the amount of equipment and the pushing and pulling and just the physical demands of being a farmer. So that's kind of a unique part of our situation here. The other thing is, it's kind of unique, just mainly to our county here, is we have some transportation problems as far as people getting to the clinic. A lot of times we see we're kind of in a unique community where we have very fluid people, high incomes, and we go down to really low incomes. It's kind of an interesting diversity that we see in our county here. Sometimes some people are very challenged by maybe not having a car that's functioning properly. They'll have to get some relatives to try to bring them into therapy. And we do have a bus service that is organized, I think, by the state of Kentucky to provide some of our smaller cities and counties services. But it's kind of unique in that the patients have to schedule that bus to pick them up 72 hours before their physical therapy appointment or their doctor's appointment. So it's kind of interesting. It kind of flips it back on their responsibility to get that transportation, which leads to some challenges for them as far as canceled appointments and everything. But it is a kind of nice service that we wouldn't normally have. But we're kind of located in real close to downtown. We often have patients actually walk to the clinic if they need to in order to get the services. So those are some of the unique challenges of working in a small town. Is you want to be kind of surprising about the transportation issue, but it is a big kind of a big deal here in the county. It's something you probably wouldn't think about.
Save the date for the 2024 AOMPT Conference, October 23rd to the 27th in Orlando, Florida. Join OMPT professionals for 5 days of continuing education focused on OMPT, hands-on learning, research, networking, and more. Visit aaompt.org for more information.
Yeah, that's great. We're thousands of miles apart, with me being Hawaii, you in Kentucky. Yet, what you're talking about is the same kind of situation that we have here. There's a big ranching community and farming community, and these ranches that it's a 7-day-a-week job, no days off. Those animals need feeding or attending to or whatever it may be. So in some situations with people working the desk job or whatever, you can say, take a few days off and let's let this heal a little bit. That's not an option for these people. They're going to get on that tractor. They're going to be moving that hay or whatever it is, because the job needs to be doing. So, salt of the earth, good, hardworking people. And the dichotomy of the incomes and the wealth here is also kind of remarkable. That we have many billionaires in the area, that all kinds of people with all kinds of money. But most of my population, they're working service jobs, or they're working housekeeping in hotels and whatnot, minimum wage or barely over that. A lot of recent immigrants as well. And so they have all the challenges associated with not having a lot of money and living in a very expensive place, with transportation and
Right.
housing and all
Yeah.
that. So
Yeah, that's the same
it's,
thing. We got within just a mile radius of the hospital here, we have multi-million-dollar farms, horse racing farms, and then we have the same challenges in the city as you guys sound like you have too, just some lower income people that are struggling to make ends meet. It's a very unique balance that we see, and right now we see more of the not as high affluent people coming into therapy.
yeah, that's great. Well, I really appreciate you taking the time to chat with me, Kurt, and look forward to connecting again, maybe at a CSM sometime, or whatever. But it's been great chatting with you. I appreciate it.
I really enjoyed it too. Thanks a lot.